Vincent, help me, I'm confused. There was Elan that had just rejected a $5.7 billion takeover deal from Royalty Pharma, and now it goes and buys a royalty stream. What's going on?
Well, what's going on is that it's trying to escape the clutches of Royalty Pharma. Basically what you have here is a hostile takeover situation where Royalty Pharma is trying to buy Elan. Elan has rejected the bid outright and is now, as part of its defensive strategy, but also as part of its sort of reinvention of itself after it sold its last operating assets, has spent $1 billion buying royalty streams from a company in California that's getting the royalty streams actually from Glaxos. So it's quite a sort of complicated linkage there, and it's essentially Elan, it's punting on the success of others, basically.
But there I was thinking that Elan, at the moment, was getting a royalty stream and had a cash shell. It wanted, I thought it wanted to re-enter the sort of traditional pharma business, and here it is buying revenue streams.
Well, it may do so yet. It still has money left over from the deal that it did earlier in the year with Biogen IDEC. This is sort of phase one of its strategy, if you like, and I think it kind of fits into the strategy that Kelly Martin, the CEO of Elan, set out earlier on this year about what they would do with the cash that they got for that. They have a lot of cash still, but yes, it's the deal as it is very much the kind of deal that Royalty Pharma does all the time, and Elan is a cash and royalties shell. That's all it is. It's assets are royalties and cash. There's no operations there, so it's a sort of larger version of royalty, except maybe a more specialised one. Whether it's going to work or not as a defensive mechanism, who knows? Although it does, I think, make life more complicated for Royalty Pharma.
And do we have any financial statistics around the revenue stream? I mean, is $1 billion a high price?
Well, I mean, basically, these drugs that it's buying into are in the respiratory field, and they're being developed by Glaxo. Respiratory is a huge area for Glaxo, so Glaxo needs these drugs to be successful. Some people say they could be blockbusters. Who knows? I mean, if there's any such thing as a blockbuster drug left in the pharma industry, actually, is a very good question. But Glaxo has a lot riding on the success of these drugs. Theravance has a lot riding on the success of these drugs, and now Elan does as well. So, but Elan is very dependent on the other two.
Final quick question, where does that leave Royalty Pharma's bid? Is it going to come back now?
I think Royalty Pharma's bid was getting very little traction anyway, and this makes life more complicated for it. I think either Royalty Pharma is going to have to increase its bid or really walk away.
Well, who knows? Elan may now be its genuine competitor in this royalty space. Thank you very much for that update, Vincent.